All right, acute sport injuries, when to stop and when to keep going. This is a really interesting topic that I don't think gets a lot of attention. I definitely think there are extreme positions you can take, especially if you believe that pain is synonymous with injury. I personally like to think of pain as more of a spectrum, a continuum from relatively benign to, oh shit, I probably just broke something and better tap out. I started thinking about this topic the other day during a 5-mile run. We were about a half mile into the run. My running partner and I had agreed that we'd each push it at our own pace for the first 1.5-mile climb. He was already about 50 or so meters in front of me when I felt a sharp, painful tug in my right groin. It persisted with the next few steps. My running partner was too far ahead now to call out to, and I had left my cell phone in the car. I had to make a quick assessment and decide whether to keep going and meet him as planned at the trailhead, or call it and figure out how to let him know. So I slowed down my pace, adjusted my gait, and took a few cautious steps. The pain eased up. I held this pace for a few more steps. No pain. I picked up the pace. Still no pain. I ended up running a 5-minute PR, and it was completely pain-free. So the question is, how do you know when you can push it or when you need to back off? Okay, quick disclaimer. All the content provided in this video is for informational purposes only and is not a substitute for medical advice. All right, moving on. So pain is a complex physiologic experience. What we have learned is that not all pain signals are created equal. The question is to identify how to listen to the pain and stop engaging in the sport, and when you can likely push on without risking further injury. The answer to this question may not be the same for every athlete. If you're relatively new to a given sport, you may be more likely to call it for aches and pains that you've never felt before. As you become more experienced in the given sport, you'll have a better idea of what you can push through. Having experienced the pain or similar pain in the past or having a related chronic injury may also give you a sense of what you can push through and when you should stop. For instance, I've had plantar fasciitis twice in my running career. Both times I felt the pain come on during a training run, and both times I kept going. I spent the rest of the training cycle battling heel and foot pain. Had I stopped, would things have turned out differently? I don't know, but you can bet your ass I'll definitely try next time. It may also depend on the sport, your experience with the sport, and whether or not you can modify the movement to avoid the pain. Other factors to consider are whether you're training for a competition and where you are in the training cycle, or if you're actively competing. This is just an algorithm that I've kind of developed to help you quickly assess the sudden onset of pain and decide how to proceed. What I offer here is just one way to think through things. This is kind of the modality that I use when I'm out there, either lifting or running, and kind of a framework to decide, should I keep going or should I think about stopping and preventing further injury? So the presence of what I'm calling red flag symptoms include the inability to bear weight, severe swelling, bruising, or weakness, or visual dislocation or fracture suggest severe injury, and further engagement in the activity is likely to worsen the injury, which is likely not worth it. Whether you're recreational or you're a pro athlete, you'll likely only increase the damage if you keep going, resulting in longer recovery time. So I recommend stopping, getting it checked out, and resuming training when healed. If there are no red flags present, there's more of a decision tree. If you have a history of an injury or known chronic issues in that location, then it's probably best to proceed with caution, since this could put you at higher risk of sustained injury. History of chronic injury with frequent re-injury with the sudden onset of pain in that area should make you think twice. This is like the plantar fasciitis I mentioned earlier. Personally, I have a history of chronic injury with the onset of plantar fasciitis, and I've had this injury twice, so I know that continuing to run will likely lead to recurrence of my plantar fasciitis. So this may make me more likely to stop. Sometimes a little shakeout, adjusting position, or easing off the pace is enough for the pain to resolve. If that's the case, I'm usually more comfortable pushing on. However, even if it doesn't, but you're competing at a high level, in a high level competition, then your decision to endure pain with the potential for injury may be higher than if you're in a training phase. Again, none of these are hard and fast rules. I'm just offering one way to assess acute pain while you're actively engaged in sport to help guide your decision about how to proceed. I would definitely love to hear your thoughts on how you approach these situations and what you're thinking about as as you proceed to avoid injury, but also not limit your training because of the occasional, occurrence of pain. All right, be sure to check out more content. Thanks for listening. I'll see you guys later.